with a lot of families who have children with mental illness, and I'm wondering what your thoughts are on how we can improve the schools to provide more services for what children need. Early intervention is so important, and so many kids are getting overlooked in the school system.
Yeah. We could spend a whole session talking about that, and that alone. I'm bringing up my wife, Kathy, but some of you may know her. She ran the Children at Risk unit at Connecticut Legal Services for a number of years, mainly doing special education work. And so this has been a family passion of ours as well. So you know what happens in these school systems. Because these school systems, effectively have to eat what they kill, right? They only can run based on the local property tax revenue that they collect, and they can't share burdens outside. There's really no incentive to do better for kids with disabilities, because you're just going to run up your cost. And for some school systems, they tell me, well, if I have a really great package for kids with special education, then there's going to be a lot of families going to move to my town, and then I'm going to have to, essentially shoulder more of the responsibility for paying for students with disabilities or mental health issues compared to our peers. The state has tried to remove a little bit of that disincentive to care by picking up some of the share of special education costs, but ultimately it shouldn't be a town-by-town responsibility. There's just no reason, there's no good public policy reason why every single municipality should have to cover those costs. It should be a cost that's borne by a much larger geographic area, I would argue the state, but it could be a new system of regionalism. And so if you want to figure out how you get out of the position that we're in, from Connecticut's perspective, you've got to figure out a way to share the responsibility of special education outside of each individual school district. But there is, of course, a federal solution here too. When IDEA was passed, which of course is an incredibly important law and provides many of the rights that allow families to get into treatment plans, it made a promise that the federal government would pick up 40% of the cost of special education. You guys probably know what the number is for Connecticut today. It's 6%. So the federal government's share of special education costs in Connecticut is 6% compared to the initial promise of 40%. That's just a money issue. That is just a money issue. We don't have the money to cover 40, so we cover 6. And so that's why you also have to pay attention to this much broader fight about whether or not we have enough money coming into the federal government to do all the things that we promised. We do not today. We are taxing at a historically low level when you look at the scope of the last 60 years. And if you eventually want to have the federal government truly participating with school districts, trying to help them pay for these costs, well, then you got to actually tax more than we are today. And that is politically toxic to talk about, but it is totally unfair to try to expect the federal government to do everything that it said it's going to do when we're only taxing at about 16 or 17% of the country's GDP. Yeah.